Hello, my name is Jamie Beatles, and today I will be going through a head-to-toe assessment for my video presentation. My summary is an 8-year-old boy who was admitted Thursday, November the 10th for acute bronchitis and asthma exacerbation. The patient is able to hear but unable to speak and writes his responses and requests on paper. The reason why I have done this is because when I do my presentation, I have to use headphones in order for you to hear me clearly. So my son can speak, but I was trying to be creative on how I could actually do the actual assignment so that you could understand what's going on and be able to hear. So instead of being able to talk, I'm just going to have him answer my questions by writing things down. So that is how we're going to be able to communicate. Back to the summary. He presented to the ER with increased respirations, decreased oxygen saturation, wheezing, increased temperature, coughing, fatigue, and shortness of breath. After a 3-day stay at the hospital, he is to be discharged home around 11 o'clock a.m. All tests and labs were completed within range, and the patient's medication changed from IV steroids to by-mouth medications. Prescriptions will be given upon discharge home, and a clinical prevention strategy is to be addressed with the patient. So here we talk about bronchitis, and here's asthma. Upon entering the room, we will collect vital signs. We'll get our Dynamat. And these are the vital signs prior to discharge home. We'll start off with loving kindness towards others. In order to display loving kindness to others, we will make sure that we wash our hands, make sure that they're nice and clean, and also to include any kind of safety precautions that we may need for contact measures. Also, as always, providing privacy for the patient. Then we'll continue with healing and trusting, caring relationship. Nursing goes a long way on that. But in order to start that process, we need to make sure we always get a nice, good, clear introduction. Hello, my name is Jamie. I'll be your nurse today. How are you doing? How are you feeling? Are you in any pain? Ask those questions. Also, you want to make sure that you, after introducing yourself, identify that patient. Not necessarily by a fingerprint. Who knows, that might be the way our world's going. But we're not going to get our fingerprints. But we will ask for name and date of birth and all that wonderful stuff. Next, we want to do therapeutic communication. Gotta listen. Gotta pay attention. Gotta hear what's going on. Being able to read those clues so that we could be a nurse and be it very effectively. So we're going to listen to those verbal and nonverbal cues. We're going to make sure we have good eye contact and not to appear rushed. See this poor guy here, poor guy in the cartoon. So sad. Next, we're going to do a general appearance. We're going to take a good look at that skin. Checking on the skin color, the general appearance. Make sure we're positioning the patient very well, taking note of facial expressions, the moisture of the skin, looking from head to toe. Also, we want to take in consideration of any oxygen. Is the patient on oxygen? Is that nasal cannula hooked up right? Are those leaders hooked up and going the right way or in the right amounts? And also make sure that your tubes, every single tube that you have on that patient, whether chest tube, oxygen, IV, if there's a tube attached to the patient, take consideration and paying attention to those as well. Next, let's go ahead and go over that mental status. Seeing how that is. Alert and oriented, levels of consciousness. This is like my son right here, busy. Do that good examination, appear how he's speaking, how he thinks, how he feels or she feels. Don't forget those special touches. Next, we're going to go ahead and look into the head, ear, nose, throat, neurological system. We're going to check those cranial nerves, the vision, smelling, hearing, Does his head turn really good side to side? Can he shrug those shoulders and stick out that tongue? Gotta take that all into consideration. We do that with the HEENT. Then we have the cardiovascular system. Without that, there wouldn't be us. So taking into consideration the cardiovascular, palpating, listening, inspecting, looking at those jugular veins, make sure we're checking all those pulses. There's so many wonderful pulses in the body. We gotta make sure we are checking them and make sure they are good. We also want to listen for those heart sounds. Is everything going good? What about our blood pressure? Back to our vital signs. How's that heart rate going? How's that blood pressure? Was it within range? Great. If not, we need to see what's going on. Next, we have respiratory. This is why our little guy got into the hospital, his breathing. So that's going to be a really good focus of our attention as a nurse. But like I said, we're going to be doing the head-to-toe assessment, but we do want to also take special consideration of that respiratory system for our little guy. Making sure his lungs are clear. What do they sound like? His oxygen. We took him off of oxygen before he's going home. We're de-seeing his steroids. So we want to make sure, is everything going good? Is he breathing good? Is he in any kind of distress? We want to make sure, is he having any shortness of breath, abnormal breathing sounds? We got to take all of that into consideration. Then we have a nice GI system. Check out these happy tummies. Happy, sad, angry. Pay attention to the stomach. We're going to listen to it. We're going to palpate it. We're going to do deep and light touches. We're also going to listen to all 4 quadrants. Is everything going good with all of them? Is he having any bowel movements? Are there any kind of vascular sounds down there in the stomach? Shouldn't be down there. You should be hearing some things move around and growl. Then we have the neurological musculoskeletal system. This encompasses a lot of things. How do you like that picture? Check him out. We're going to make sure that we push and we pull those upper and lower extremities. We're going to ask for hand grasp. We're going to ask for leg pulls and pushes, feet pushes and pulls. We're going to make sure that all of that is covered. Then we're going to go into our clinical prevention strategy. Knowing what causes your asthma and trying to stop an attack before it gets worse. Using your inhalers the doctor tells you to. Letting an adult know you don't feel good. And taking breaks when you feel that feeling in your chest and your lungs. We hope this patient isn't smoking. I know as a mother he's not. But we want to make sure he's using his inhaler correctly. Is he around people who are smoking? And if so, how can we eliminate that? If you're an adult, or if you're a snowman, here's some good ways to kind of have some clinical prevention strategies right here for this snowman guy. And then we're going to do our overall assessment summary. So this is my summary from after I had taken care of the patient and did his head-to-toe assessment. This is just my write-up. It's just quick, simple, it's to the point. And lastly, triggers. I just saw this and I thought this is a really good slide. So I figured I'd put it together and print it off, and it just talks about more triggers for asthma, those irritants. So again, I want to thank you so much for taking a look at my head-to-toe assessment. And like I said, I will have another video that follows. It won't have sound, it'll just have music to it. And my son and I will be talking and he'll be writing his answers just so that you guys could kind of know what's going on, since my wonderful video needs headphones in order to work. Thank you so much.